In rural hospitals and clinics across the country, there are massive staff vacancies. Here, where almost half of South Africa's population lives and only 12% of our doctors are willing to work, this shortage is a matter of life and death. This year, Health Minister Dr. Aaron Motsoaledi will launch the first phase of his ambitious National Health Insurance Plan. Central to this is improving basic health care in rural areas. He feels the answer to the staffing crisis lies in the heart of these communities.
Training young people from rural areas is extremely important because that's where the biggest shortage is. Because many people after training don't want to go to rural areas. But it has been proven that people who come from rural areas, when they complete, they do go and work there. I'm one of them, by the way. I only came here because I was redeployed to be a minister. Otherwise, my work was in the rural area. I was born there, I was bred there. I couldn't think about going to work to any other place. That was my home. And I was very proud to go back and work there. And I hope there are many youngsters who will do the same thing.
This is Tlhabisa, one of the most deprived areas in Kwa-Zulu Natal. Desperately lacking infrastructure and job opportunities, around 80% of families live below the poverty line, cut off from basic services like water and sanitation. Faced with South Africa's deepening health crisis, rural communities have limited chances of survival, and mortality is rising. At Tlhabisa Hospital, Dr. Patrick Ngwenya is one of only 9 doctors serving a district of over 200,000 people.
It's quite challenging. Everyone, when they come in, they come with energy, and they know that they can do a difference, make a difference. But the burden or the workload drains you quite quickly. But the thing that keeps you going is helping someone whom you know that without you, they could barely make it.
Patrick works mostly in the maternity ward, one of the busiest wards in the hospital. Around 400 babies are delivered here every month. Because teenage pregnancies are common and many expecting mothers have sexually transmitted infections or HIV/AIDS, complications often arise. Without him, these could be fatal.
You say a pregnant woman comes in, you manage her, and she delivers, if God willing, a live baby, as we've seen the kids, just fresh newborns. I mean, those innocent faces, and you just say, wow. I mean, she was pregnant 2 minutes ago, and now she delivered. And everybody smiled. You forget about pain. I think it's also sort of a booster to you and your morale. At least you go home smiling despite of hard work.
Patrick is a doctor today thanks to the Mtombo Youth Development Foundation, which supports rural youth to become qualified healthcare professionals who will, on graduation, return to work at their local hospital. Heavy workloads under stressful conditions mean that rural hospitals everywhere struggle to attract and retain qualified staff. Born in a rural area, Patrick understands the struggles his patients endure, a motivation for him to stay and make a lasting difference.
But if I know I've got only 1 year to hit and run, there's nothing that I would like to improve or to leave something like a legacy for the next generation or next colleagues to come in and build on. Just come and work and go. But if you know you still have 5 years, during your stay you want to have something that you can point out that at least I've made a difference or a change in 1, 2, 3.
Patrick grew up in the rural village of Manguzi, only a few kilometers from the Mozambique border. Whenever he can, he visits his mother, who still lives in the one-roomed hut, which he built, where he once lived with his 3 siblings. For years, they never had piped water, and to this day, they still do not have electricity.
Inside, I dreamt of having a big house one day, either for myself or building one for my mom. But it was like a real mountain that needed to be climbed, and I knew it's going to be a journey. The question of how, whether I will reach there, well, it was uncertain.
Patrick never lost touch with where he is from, which helps him empathize with his patients.
Okay, this is my home. That's where I grew up. I've got very good memories of this place. When I was young, I think I was doing grade 11, we planted these mango trees, and now you can't believe it because they're that big.
They eked out an existence from the land growing crops and wove handmade baskets to sell on the side of the road to earn a little extra. Poor schooling and without the financial means to take his education beyond high school left Patrick with few options for his future.
I got depressed a lot before, immediately when I completed my matric, because I looked like my life was on a stop street. I didn't know which direction to take, and it took a while to get myself on my senses,
After high school, Patrick became a construction worker. It's hard to believe that less than a decade later, he is now a talented doctor, able to save lives. Now he's building his mother and siblings the new home he's always dreamed of. There was a time in his life when this would have never seemed possible.
I think it's the greatest feeling any man or young man can ever have. It's quite difficult for our background because most of our parents, they hardly leave things that we can point to say that my father left this for us. So you almost always start from the scratch.
It took him many years, sheer determination, and a life-changing bursary from the Mthombo Foundation to get to where he is today.
The biggest pressure was you knew where you come from, and failing was not an option, and it was not an excuse either. Where you come from, you don't want to go back being the same person. You need to be seen as a hero, even though most people, they don't worry whether you get good grade, but at least they know you must have your degree in your hand, and you don't want to disappoint them.
Zamani Dlamini is a final year nursing student at the University of Zululand. He was born in Hlabisa, and like Patrick is a recipient of a bursary from the Mthombo Youth Development Foundation, an organization which targets rural youth as future healthcare professionals in their communities.
I was so happy, and actually I was excited with those news when I received the letter that now you must come and register at the University of Zululand to do nursing. My dream now come true, and even when I'm walking the passages, I walk tall because I feel this inside my heart, because nursing is my calling.
Of the 1,200 medical students graduating in South Africa annually, only 35 end up working in rural areas in the longer term. Research shows that students from rural areas are more likely to go back home to serve the communities they grew up in.
I believe that nurses are most important people so maybe in someone's life, because they care for the sick people. And then also I think that if ever maybe one day I'll be sick and then I will be sleeping in bed in the hospital, and then the nurse will come and nurse me. So that's why I feel so honored.
Zamani is one of 150 students the foundation is currently financially supporting through their higher education.
The people from the area can be a solution to solve those problems. That's one thing. They are coming from the area. They know the language. They know how people are suffering from the area. Maybe they have been affected by that.
It's been a long and challenging journey for Zamani to get to where he is today. He is going back home to visit his family in Bembeni, a small village on the outskirts of Hlabisa. Unlike Zamani, many young men from the area leave to find work in the cities and never return. He is greeted by neighbors and family, all grateful that he wants to come back home after graduating.
I don't know whether I'm a hero or whether I'm a star to them, because I'm the first one to do a degree in my community. There are some of the nurses in my community, but there's no one who went to university as I did, doing a degree as I did.
Zamani is one of 20 people who live here at his grandfather's house. Like most families in the area, no one at home is formally employed, and there are 11 children who need to be put through school. It was here, where his grandmother died, that his desire to be a nurse first took root.
she would say, one day I want you to be a nurse. I want, so because you did care for me, you did give me some food, you did give me some water, and then I believe that one day you're going to be a nurse. And then Gogo, and then say, Gogo, where I must start this nursing? Then I don't know, but you must be a nurse, because in this way you can't live without any paper in your hand. With the paper, you can be a hero, and you can be, the paper for you can be the key to any door in this world.
Zamani's parents separated when he was very young, and his grandparents raised him. The only source of income in this household is the odd jobs his 82-year-old grandfather gets as a bush mechanic. A quietly determined child, Zamani was always a dedicated student.
When it's come to studying, it was very difficult during that time, because you're supposed to come back from school, go and fetch some keklis from my grandfather, and then there's little bit working, a mechanical work. My uncle will ask, "Hey, come here, we're working and there's no time for school." So it was very difficult. And then maybe I started studying about 9 o'clock, because I was busy with mechanic things, fixing some trucks, fixing some cars. So it was very difficult, but so during that time I was using the Kengli to study.
Zamani persevered and with single-minded focus got himself through his studies.
The main concern that I was having is about my family. My family is not living the better life, because my grandfather is there we are so many in this house. So I've got 2 dreams here: to uplift my family and then to do my nursing degree. By doing nursing degree, I will also uplift my family. And then I was so focused on what I was wanting to do.
Zamani's high school was 15 kilometers away, and with no money for taxi fare, he had to make the long journey on foot.
I was supposed to leave at 6 o'clock, and then 2 hours journey to my school, and then it was difficult for me. And then I will always ask for the 1 rand to my uncle, to my aunt, just because I used to have something to eat in the school, and then they would just give me that 1 rand, and then I feel so great.
Things were different when Zamani completed his matric here. There were 300 students per class. He also had no one to look up to, a role he can now play for these students, as he understands how poverty can threaten one's dreams.
I always say, born poor, but destined to rise, and to rise to the greater heights. And then, because where I came from, people were just look at me down. You won't be this, you won't be this. They were judging me. But I said to myself, I want to be a nurse.
Zamani wants these students to see that someone from their community and who went to their very school has realized his goals.
So during that time, I was only knowing of the 4 careers. It was a teacher, a nurse, a doctor, and a police. We were not knowing that there are many careers: biochemistry, physiotherapist. We've got no idea about that, because there was no thing that known as career guidance.
For many of these students, their only hope of studying further is through a bursary. However, even making applications can be impossible.
When I was doing my grade 12, I was used to apply to some hospital to send my application for some training. It was difficult because there was no man for buying those envelopes. I was having no idea how to write an CV, how to write an application letter.
Zamani's applications failed, and he knew that his fate was sealed. He had to go in search of work.
Our parents are not educated, and then if they see young men growing, they think of, oh my God, this son must uplift this family, this son must go to work. To go to the mines, that was one of, I don't know whether I would say community belief, or because everyone who finished matric during that time was going to Johannesburg, and then it was not my dream to go there.
While many of his contemporaries went to the mines in Johannesburg, Zamani returned to work alongside his father at Tlabisa's taxi rank. His time here was the darkest period in his life, where he could feel his dreams slipping away from him.
Waking up in the morning, know exactly that you won't get anything much for living. You won't earn a lot of money for living, and you know that a lot of people are behind you. They are looking for you, whether you will come with something to eat afternoon. So those things were just discouraging me. I know that if you go for studying, you won't earn anything. So that's why I just lose the hope somehow.
For Zamani's friends, little has changed. He remembers how he desperately held on to the hope that one day he might be a nurse.
So this little money, 250 per week, 150 per week. So it was too little for me to go to the university, up until my father promised that he will give me maybe some goats to sell, and then I will have that money. But I was having that dream even if I was a taxi driver. So I feel so happy if the nurse will come to my taxi, and then I will chat a lot with the nurse because I was wanting to be a nurse.
One day he heard about the Mtombo Foundation scholarship, made his application, and his life changed forever.
In my area, they would say nurses are the people of the high class. And then they will say, you Zamani, you just want to be people of the high class. And then I say, no, I want to be a nurse. I want to serve the very same community, the very same you that you're saying, I want to be the people of the high class. And then I will serve you, and also your parents will be served by myself.
When Zamani Dlamini started his degree at the University of Zululand, his dreams were finally within reach, but it was not easy to adapt to student life. Coming from rural areas, many have never been to a big city before. They also have a poor schooling foundation, and so have to put in a lot of extra work to manage academically.
In our high school, there was no computer labs, nothing. Only the first time I see my computer, it was here in this university, and then I was so excited. During the time when I have to press to move the mouse, you see the hand was so shaking. But I managed to do some. It was great for me.
Dumisani Gumede is one of the first recipients of an Mtombo Youth Development Foundation bursary, and now runs the mentorship program, which helps students like Zamani cope with these challenges. It's an integral part of the project's success, which has achieved a pass rate of nearly 90% from their students.
I can tell you, most of our students are not failing because they're not coping academically, but they are failing because of the problems back at home. So that's why we feel that our mentoring is so vital in terms of breaking those problems.
Thanks to Dumisani's guidance, Zamani is now excelling at his studies, but often these students have more to worry about than just academic performance.
The other problem that we have noticed in our mentoring system is most of the time our students are coming from very poor families. He or she knows that at home they are suffering, they've got nothing to eat. So they end up, whatever you are giving them for food, end up dividing that and sending back home.
Established 11 years ago, the program has graduated over 100 medical professionals, not just doctors and nurses, but pharmacists, dentists, physiotherapists, and other essential personnel.
Previously, most of the doctors who were working in the area were white, especially from overseas, not even local. So most of us were thinking that, no, this profession is for this race. So tend to believe that if I saw this person grew up in this area, started in the same school, why not? What can stop me doing it? So it's kind of motivating, because one person's got light now, so everyone comes and get light from this person.
Almost all of their graduates have remained working in the district and in the public sector.
For me, being in this office, it's nice to see students passing. You feel excited that, yes, students are doing it.
With almost 40,000 vacancies for doctors and nurses in the public health sector, Dr. Patrick Ngwenya is a scarce and valuable resource. He could work anywhere, and yet he chooses to serve his community.
I think it's more than a feeling, more than anything. Yeah, it's a feeling that you treasure inside, because you can't show it to other people. because we've got some colleagues, I mean, they ask you, hey, Chief, why are you parking there in rural? There's a lot, the posts are everywhere, public and private. While private, they even offer better salaries. Okay, they did an injection. Some other things you realize in life, money cannot buy them. Inner fulfillment. If you immediately when you finish your work at hospital, you go home, you sit down and try to replay the film. What is it that you have done right? Which smile that made your day most, you know? Yeah, and those are the things that keeps you going.
Zamani is on the brink of graduating as a professional nurse, a day he has been dreaming about for almost a decade.
I don't know whether I'll feel excited or maybe I'll cry, I don't know. Because that was the moment that I was waiting for, even if I was doing my grade 11. It would be a graduate wearing that gown, shaking hands with those professors. So I don't know how to explain it.
After he graduates, he will be placed at Hlabisa. He is undaunted by what will be expected of him as a nurse in an under-resourced hospital.
I feel so proud, especially to serve the people from my community, because in English they say opportunity must meet preparedness. So I'm prepared in working under those stressful conditions. I'm prepared to work with those wards that are understaffed.
He feels that this is where he belongs.
If you are raised in that community, you are not raised by your parents alone. Everyone in my community, if you are in the same age with my father, you are my father, no matter where you can send me to. If you are in the same age with my mother, you are my mother, no matter where you can send me to. In my area, I feel as if I belong in that community. They're just my family also.